I am pleased to welcome back Dr. Albert Rizzo. Dr. Rizzo is the Chief Medical Officer of the American Lung Association. We're so grateful to have a presentation each year on the association's air quality report card for counties and cities across the United States. Dr. Rizzo?
Thank you. Thank you. My slides here. So good morning, and thanks for inviting me and the American Lung Association to join today's conference. I want to share highlights from our yearly State of the Air report. It's released each year in April. Near the end of my discussion will be some advocacy actions I hope you will consider. Excuse me. Since its inception, the State of the Air has been tremendously successful in raising awareness about ozone and particle pollution, the two most dangerous and pervasive air pollutants nationwide. The American Lung Association is proud and grateful that the public, the media, and clean air advocates and decision makers have used this report every day, year after year, to call attention to the work that remains to be done to protect the health of all Americans from the threat of air pollution. First, let me give a little background. In the year 2000, the American Lung Association launched its annual State of the Air to provide the public with easy to understand information about the quality of the air in the local communities, based on the credible data and sound science that EPA is required to use to set the air quality standards. For several years, State of the Air focused solely on ozone pollution and included data for 5 populations at risk: children, older adults, children with asthma, adults with asthma, and people with emphysema. In 2004, changes to the air quality standards and the deployment of air pollution monitoring enabled the addition of short-term and year-round particle pollution to the report. Over time, accumulating scientific evidence has shown a significant health harms from both ozone and particle pollution among other groups of vulnerable individuals. State of the Air has accommodated this new information by gradually adding populations at risk categories to its reporting. The State of the Air report in 2021 now includes up to 10 vulnerable groups. The State of the Air pretty much puts air pollution into everyday language and gives the public local air quality information, but it also focuses attention specifically on ground level ozone pollution or smog and particle pollution or soot. The first step in states is to collect the air quality data from monitors across each state. And that data is collected from 2019 report on, and it collects 3 years of data several years after the report. So this current report from 2021 includes 2017, 19, and 20. And those are available due to the reports that are available in the rankings. Now this gives us grades through 935 US counties with air quality monitors and ranks the 25 metro areas with the worst pollution for the 3 pollutants that we look at. It also tells us which are the cleanest cities. Now, only counties with monitors get grades, and we only grade the air quality, and this is not an effort to necessarily clean up the data. We base our letter grades on EPA's Air Quality Index, which is the EPA's yardstick for reporting air quality. We look both at days on which the levels are unhealthy. We also weight according to how unhealthy. We grade particle pollution 2 ways, both by the number of days that levels spike, or the short term, and also by the annual average level, or long-term pollution. The report champions clean air for all by providing relevant local data that provides context. It includes stories from individuals impacted by air pollution, like the one shown here on the slide. And we know that personal stories often have impact far more greater than statistics, especially when it comes to advocacy matters and talking to decision makers and legislators. As we'll see in a few slides, the report also shows that air pollution doesn't impact Americans equally, and includes the key message that everyone deserves clean air. It calls to prioritize health equity and environmental justice, includes specific advocacy priorities and tools for taking action. The annual report also focuses on the specific health harms of air pollution. Ozone has a serious effect on the respiratory system, both in the short term and over the course of years of exposure. When ozone levels are high, many people experience breathing problems such as chest tightness, coughing, shortness of breath, often even within hours of that exposure. Even healthy young adults may experience respiratory symptoms and decreased lung function. Other problems include worsening of symptoms and increased medication use and increased emergency room visits and hospital admissions for people with lung diseases such as asthma and COPD. Susceptibility to respiratory infections such as pneumonia, resulting in increased likelihood of emergency room visits and hospitalizations, also occur due to ozone exposure. Living with ozone pollution long-term may cause lasting damage to respiratory health in general, including more cases of asthma in children, and damage to the airways leads to development of COPD and increased allergic responses. Particle pollution comes from many sources: factories, power plants, diesel and gasoline-powered motor vehicles, cars and trucks, and equipment either directly emit the fine particles or generate the precursors such as nitrogen oxides that can form into the particles in the atmosphere. Other sources include wildfires, burning wood in wood stoves, or residential fireplaces. And particle pollution can be very dangerous to breathe, especially at higher concentrations. It itself also can trigger illness and hospitalization and premature death. Researchers estimate that PM 2.5 is responsible for nearly 48,000 premature deaths in the United States every year. Breathing air pollution harms everyone, even healthy adults, but some groups face an even higher risk. We call attention to the millions who are at risk because of the air in their communities. Those who are at risk or are more vulnerable to air pollution include children, anyone over 65 years of age, people who work or exercise outdoors, people with pre-existing lung diseases, people with cardiovascular disease, people with a history of smoking, people with lung cancer, people of color, people with low income, and people who work outside. And you heard a lot about this from Dr. Shepard earlier with regard to the disparities. But basically, someone in everyone's family faces a greater risk from air pollution. This report also includes information about how to protect yourself and your family from exposure to unhealthy levels of air pollution. Key messages from the 2021 State of the Air report are listed here, and are that the nation continues to make progress in cleaning up the air, but despite that, more than 4 in 10 Americans live with unhealthy levels of air pollution. And the last 3 bullets speak to the disproportionate burden of poor air quality on certain groups. The burden of living with polluted air is not equally shared, as we heard somewhat from Dr. Shepard. People of color are significantly more likely to be exposed to unhealthy levels of air, ozone, and particle pollution. We must prioritize cleaning up disproportionately burdened communities so that everyone has an equal opportunity to breathe clean air. Digging into some of the findings in the report a bit more, we found that more than 135 million people live in counties that received at least 1 F grade for air pollution. Now that's down from 150 million last year, but it's 10 million more than in 2017. Most of the improvement in this year's report, which covers 2017 to 2019, was in counties that had failing grades for ozone in the previous report. Unfortunately, the threat of deadly particle pollution continues to get worse. This year's report showed an increase of more than 1 million people living in areas with unhealthy levels of short-term PM compared to last year. Now, for the second year, our report was able to include people of color in our counts for populations at risk, which has revealed a clear disparity. Looking at the data nationwide, we found that people of color are 61% more likely to live in a county with a failing grade for at least one of the pollutants that we measure. However, compared to white people, however, over 3 times as likely to live in a county with all 3 failing grades: ozone, short-term, and long-term PM. Once again, last year, the State of the Air report shows that climate change continues to play a role in the nation's air quality. State of the Air 2021 is our 22nd edition of this annual report. And from the beginning, the findings in State of the Air have reflected the success of the now 50-year-old Clean Air Act, as emissions from transportation, power plants, and manufacturing have been reduced. In recent years, however, the findings of the report have added to the evidence that a changing climate is making it harder to protect human health. The 3 years covered by the State of the Air 2021 ranked among the 6 hottest years on record globally. The heat and drought caused by climate change in the Western US, causing wildfires that are larger, more frequent, and more widespread, leads to increased particle pollution. And these fires are the primary driver of the increase that we see in short-term particle matter pollution. Heat's also an important role in the formation of ground level ozone. We speculate the reason that this year's report showed improvements in ozone levels during 2017 and 2019 is that the year 2016, the hottest on record globally, dropped out of our calculations this year and allowed some of the improvement in the ozone that we see. 2017, 18, and 19 were a little cooler than 2016, but we're still among the 6 hottest years globally. The concern is that as climate change continues to worsen, causing average temperatures to keep rising, ozone pollution will be more likely to form and climb and be harder to clean up. Now, the COVID-19 pandemic has driven home to the world the preciousness of our healthy lungs. The State of the Air 2021 report covers the years 2017 through 2019, and therefore does not reflect any changes in activity patterns and air quality that may have resulted from the COVID-19 pandemic. In 2020, it occurred mainly in 2020. That data will not be available until next year's report at the earliest. But we know that the quality of the air we are breathing has an impact on the severity of the pandemic. Research has shown that a community's exposure to even small increases in particle pollution over the long term can lead to an increase in COVID-19 death rates. Communities of color have been caught in a perfect storm. Many people of color are disproportionately exposed to unhealthy air. Air pollution increases the susceptibility to respiratory infections like COVID-19. It also worsens underlying chronic conditions like heart disease and diabetes, which are more common in communities of color. And these chronic conditions also increase the risk of serious harm from COVID-19. So communities of color have been specifically and especially hard hit by COVID-19, and improving air quality will be an essential part of protecting the health of people who live in these communities. As the nation continues to respond to the pandemic, reducing air pollution is critical for respiratory health now and in the future. The Lung Association will continue to champion the Clean Air Act and push for clean air, health equity, and environmental justice for all. Exposure to unhealthy levels of ozone have been mentioned, and air pollution continues to make breathing difficult for millions of Americans all across the country. In the years 2017 to 2019, more than 123.2 million people lived in the 163 counties that earned an F grade for ozone. That is fewer than in 2020, 2019, and the 2018 reports, but more than in the 2017 report. There are still a lot of vulnerable people, including 28.1 million children and 18.1 million people over the age of 65, who exposed to ozone or air pollution have increased risk of harm. Overall, the 25 most ozone polluted cities in the United States experienced fewer bad air days on average from 2017 through 2019 than those in last year's report. And again, this may reflect the fact that 2016 was the hottest and was not included in this report as it dropped out. Here are the top 10 worst cities for ozone. Los Angeles retains its position at the top of the list, and it has been there for all but one of the last 22 years. Overall, the cities on this list experienced fewer bad ozone days in 2017 through 2019 that I mentioned. And some progress is shown in that 4 of the California cities on the list recorded their fewest bad ozone days on average in the 22 history of the report. But unfortunately, they're still on the top 10 list. Now, what about particle pollution? In State of the Air 2021, all but 2 of the 25 worst cities for short-term particle pollution are in the Western United States, 10 of them being in California, 8 in the Pacific Northwest, and 5 in the Southwest. Only 2 cities are in the Eastern US. This continues to be a shifting geographic trend being driven in large part by the increasing number and size of wildfires resulting from climate change-induced heat and drought. Wildfires, however, are not the only source of high particle pollution days. Other sources I've mentioned include wood stove use, older diesel vehicles, equipment, and industrial sources that contribute to particle pollution. Changes in weather pattern can also create atmospheric inversions that trap particles in place, leading to days with particle pollution spikes. Cities with high power plant emissions, as well as local industrial sources, continue to show up on the list, although with less frequency than in the past. These include Pittsburgh, Philadelphia, the New York, Newark area, Detroit, Cincinnati, Cleveland, Chicago, Houston, Indianapolis, and Shreveport. In the years 2017 through 2019, close to 54 million people lived in 88 counties that experienced unhealthy spikes in particulate matter air pollution. And again, this represents 1 million more people than in last year's report and higher numbers than in any of the last 5 reports. On this map, the red circles represent areas that got Fs and the blue areas are As. The size of the circles represent population. You can also see how much of the country has no monitors, mainly throughout the Midwest. So in counties where there are monitors, half of the population lives in areas that get an F grade. This might be one of the criteria that you use when picking the best places to live. Many cities in the United States enjoy air that is considered clean for one or more of the pollutants that we measure, and the full list of them is in the report. This year, 5 cities are on the cleanest list for all 3 pollutants, meaning they had 0 days of high ozone or short-term PM. They're on the best 25 list for long-term PM. Charlottesville and Elmira Corning area have been added to the list since last year, and Bangor, Maine, a regular on the list in the past, dropped out this year, mainly because of some incomplete data that we were not able to retrieve. So we can't emphasize enough the fact that the Clean Air Act is definitely working. If you look at the trend lines of pollution levels over the county pages of the report, you'll almost always see a download trend from the first report in 2000. Let me get rid of that spot there. Cleanup efforts have been continuing since that time, but we are seeing the effects of climate change undoing the progress that's been made. To continue to make progress, we need to stay vigilant about protecting the Clean Air Act from recurring threats and fully implement and enforce it, including setting stronger air pollution standards and doubling down on climate change. So as a health professional, whether you're a seasoned activist or interested in seeing the positive change in your community, American Lung Association encourages you to share our trusted science-based tools to help you begin conversations and make a difference. They are part of our Healthy Air Activist Toolkit, which offers several climate and air pollution focused films to volunteers for free film screenings. American Lung Association invites health and medical professionals listening today to its community of health professionals for clean air and climate action. You can go to the website shown on this slide and sign up to receive monthly newsletters, which provide easy opportunities to take action. And one last action I would hope all of you take today is to go to the link on this slide. And please add your name in support of cleaning up methane pollution from the oil and gas industry. Methane emissions must be cut to address climate change and reduce other toxic components of air pollution. So I want to thank you again for your attention, and please don't hesitate to review the full details of our State of the Air report, which are online, along with other resources from the American Lung Association at lung.org.